to this panel on urban action to prevent childhood overweight and obesity. Welcome to all of you who are joining us at this early hour, at least in New York and the East Coast of the United States, and welcome to our panelists. We are using simultaneous translation for this session. So in your Zoom options, you will see the globe, and you may sort of tap on it and listen to the conversation in either English or Spanish. And we also encourage you as we go along to enter any questions that you have for potential presenters into the Q&A. We will, let's see, yeah. And this panel is hosted by UNICEF, the International UN Organization for Children, Cities Changing Diabetes, which is a global initiative sponsored by the Novo Nordisk to really address the upstream prevention of diabetes in cities worldwide, and by EAT, E-A-T, which is not an acronym, but is a science-based global platform for food systems transformation. All of them are partnering together and to make a commitment really globally to work together to scale up work on urban food and nutrition for children, and want to engage more organizations and individuals to join the cause. So if you are interested, I know they would love to be contacted after this. And we can ask you perhaps to put your name and email address if you're joining us in the chat room so they can have a record of your having attended. The panel is going to really explore the challenge and opportunity of urban action to prevent childhood overweight and obesity, as well as other forms of malnutrition and deprivation, with a focus on the role of urban planning in creating healthy and sustainable food environments, especially within Latin America and the Caribbean, which is a special focus of our overall international conference. The objectives are raising awareness of the challenges and the opportunities in addressing childhood overweight and obesity in cities, to really share learning and best practices from a panel who have been deeply involved in this issue for a long time, and then to identify opportunities for collaboration, including through the existing frameworks and projects, but also hopefully from some of you who are joining us this morning. The panel will run as follows. We'll start out with presentations from each of our presenters. Unfortunately, Sophia Schuff, who's the project manager from the Gale firm, is not going to be able to join us this morning due to a last-minute conflict, but her information or slides will be available to those of you who have signed on to this session, and we will be obviously showing a nice video in the break between presentations and discussion that will demonstrate the approach they have been using in cities to engage young people in the planning process. After each of our speakers, we'll have a video as a bit of a break point between that and the discussion. And then we'll have a discussion which will be questions from me, as well as questions from you. And we will close the session about 10 minutes early to allow everyone to move in to the plenary, which begins at 10 o'clock. So I think without, again, please write your questions in the Q&A box to the panel. And we'll start now with our first speaker. Micah Arzt is the regional advisor for the UNICEF program Survive and Thrive in Latin America and the Caribbean, and she's based in Panama. This program really works to improve health, nutrition, and HIV prevention among children, adolescents, and women through innovative and equity-centered approaches. Before joining this program, Micah worked as a nutrition specialist with UNICEF in Mozambique, Vietnam, Honduras, and Pakistan. So she has a very wide global experience and is also involved with a major international baby food action network focusing on feeding of young children. She has a master's degree in nutrition and has worked obviously in the UN agencies with NGOs and with foundations. So let me invite Micah to begin. Over to you.
Thank you very much, and a good day to everyone. Yes, so I think we can start with the first slide. Sorry. So a quick overview of what we are looking at the moment. In 2018, 55% of the global population lived in urban areas, so about just over 4 billion people. And in this region that we're zooming into now, the change in the past 5 years was additional millions of people living in cities. And in this region or sub-region of Latin America and the Caribbean, we're talking about 81% of the population living in urban areas. And for children and adolescents, that translates into more than 165 million children and adolescents in this region living in cities. The next slide, please. Of course, there's regional, variations, of course, more in the southern cone than in Central America and the Caribbean, but still very large percentage. So a few reflections on what that means for children in cities in general and in this region. So what we're seeing is that urbanization is contributing to the growing burden of childhood overweight and obesity across the region. There is some, there are children who are stunted as well. There's some children who are wasted as well. So there are other forms of malnutrition, but this is really the type of malnutrition that is on the rise. And in this region, one of the issues of concern is that we have more than half of urban children and adolescents living in precarious conditions. And what we're also seeing is that the urban poor, of course, there's a lot of inequities, and the urban poor face the greatest barriers to food security and nutrition. There is an urban paradox. There's a lot of wealth in cities, but at the same time, very, very high, numbers of poor people and people that are really very poor and have little access to services. So again, also inequities in access to all kinds of services, including water, health, nutrition, etc. Then unfortunately, one thing that is easy to access is unhealthy foods. They're relatively cheap in cities and quite accessible. And that again then impacts also on the inequities that we're seeing. And then the built environments, as I think we can all imagine, reduce the green and outdoor space for physical activity. So we have a very unfortunate set of conditions together. Next slide. We looked at the actual patterns and the prevalence of overweight in this region. We were able to compare data from 15 countries. And what we're seeing is that there is indeed a difference. If the average overweight percentage in children under 5 is 7.2%, it is a bit higher in urban areas, 7.5 compared to 6.4 in rural areas. It's not a significant difference, but you see that there is at least a trend in the differences indeed in overweight in children under 5. Next slide. So what is UNICEF doing about this, or what are we doing to address this issue? Of course, we work very closely together with governments, with civil society, and with the other UN colleagues. And we published a roadmap last year for action to support nutritious diets and healthy environments for all children in urban settings. And we focus on those 4 questions. Why is an urban food and nutrition agenda actually needed? Where can we take action, and what sort of relevant activities already exist? And then how do we plan to work together with our partners? And we basically focus on 4 areas. There are 4 areas of action, that is communities, schools and childcare centers, municipal governments, and national governments. Then also very recently, we published a publication on the benefits of green spaces. So that is zooming in on one specific area of attention, and the importance of green spaces for children's health and overall development, and also actions again on what to do to improve access to green spaces. So these documents nicely complement each other. Next slide. Then also just to show the conceptual framework that we're looking at when we look at food systems, and in this case, particularly the urban food system. So it's a lot of things on the slide, but you see on the right-hand side, you see the diet of children and adolescents, and then you see 4 big components that influence these diets, which is the orange one, the influences at the level of caregivers and the children themselves. Sorry, so the behaviors of caregivers and children. At the top, you see the personal food environment, everything that relates to that. Then the green slide on the left-hand side, the food supply chain, of course, very important, how that impacts, what is available, what is the post-harvest processing and distribution. And then at the bottom, you see the external food environment, which relates to the retail and commercial markets and schools, etc., and also the vendors. So all those 4 components impact on the diets of children and adolescents. And of course, in the urban setting, they have a very particular shape. And we need to address all of these if we want to improve the diets of children and adolescents. So then my last slide of substance is about an initiative, a program that UNICEF has been working on for quite some time now. And it is called the Child Friendly Cities Initiative. And it is a very interesting approach that it is quite comprehensive. And you see here is a global movement, and it is about strengthening social inclusion. It is very strong on promoting child and youth participation and on local decision making. And one of the aspects that we're now also using this platform for increasingly is in the area of nutrition. And in this region, as you can see, there are 4 countries, that are already working on it, the countries in blue, and 2 countries in light blue that are now starting to also use this platform for nutrition and including for the prevention of overweight. So it's very interesting because it's very local and very applicable to all those settings. So that's just one of the examples in which we're working together with partners to address this issue of overweight and diet in general in cities. So that is that for now. I have one last slide with thank you. So thank you very much for your attention. I'm handing back over to you, Joe.
Thank you very much, Micah. Excuse me. Let me ask you a question specifically, just kind of linking your last slide on the Healthy Cities for Children initiative and the plan to connect it to the work on the diet and obesity prevention. Have there been any efforts, maybe ask you to go into a little bit more depth in this region, because UNICEF obviously as a UN agency has significant authority with national governments and potentially with city governments, sort of how you may have really worked to either support and or I must say influence city governments to really address some of the changes that would need to be made to really sort of hit the key points of change in your sort of platform, your plan for obesity prevention. How do you work with cities? How do you influence them? What's your experience you've had so far in the region?
Yeah, thanks a lot. So the specific experiences of addressing overweight are relatively new, but on the different components, yes, we've been working together, and I think for a longer time. And I think we can how do they break it down into 4 levels basically that we work on. So that is policy, services, families, and children. So on the policy side, it is a question, of course, also looking at national policies, but also specific citywide or municipality-wide policies. So it is issues like banning the promotion of unhealthy foods in specific areas. It is working on family-friendly workplaces so that women who work in factories or in big companies, that they can have breastfeeding breaks and spaces to breastfeed. It's about improving the school environment, having drinking water available, places to play, addressing nutrition in the curriculum, nutrition literacy, and also social protection schemes, nutrition-sensitive social protection schemes. So a whole set of policies that we have good examples in different countries of. Then also the second level, the services, so building capacity of teachers, looking at schools, building capacity of health workers on, for example, counseling parents, on growth assessments, on, again, also nutrition literacy, then supporting caregivers really to implement those practices and have tools available for them to be nutrition literate, to know how they need to breastfeed, how they need to feed small children. And then the last level, of course, participation of children and adolescents in finding solutions themselves. So yes, we have examples in all those 4 areas. Yeah, thank you.
That would be very, very, very interesting and very important work, because I think we hear about children trying to shape policy. They're very powerful, young people and youth, especially in continents where the percentage of youth of the population is growing very, very fast. The other question I want to ask you specifically around your presentation is this issue of in Latin America, in the region especially, many countries face what you might call a sort of triple burden of malnutrition along with overweight and really access to food, sort of food anxiety, et cetera. Could you talk a little bit about how the initiative is addressing the other end of the spectrum, rather malnutrition, stunting, other issues that come up in the focus on children's eating patterns?
Okay, thanks a lot. Yes, you're right. There is still a large burden of multiple issues of malnutrition. Malnutrition in all its forms is what we're seeing here. And what fortunately many actions actually have proven to be successful to both address undernutrition as well as overweight. So that's the type of actions that we call double duty actions. And a few examples are, for example, doing growth assessments, actually checking how children are growing. Are they growing to, are they becoming overweight, or are they actually lagging behind? And then based on that assessment, provide counseling to parents on how they can improve the feeding and also their overall health status of their children. So that is one important entry point for that. Then also the support for breastfeeding and adequate diets of young children as a whole is very important to prevent all forms of malnutrition. To make sure that children have adequate diversity and frequency, and of course, exclusive first and then continued breastfeeding as well. But also policy issues like tax-related measures, like taxing unhealthy food products and making healthy food products cheaper. That's another important action that we can take. And lastly, policies to regulate the marketing of breast milk substitutes and the promotion of unhealthy foods are also very important double duty actions that can improve the diets of children to prevent all forms of malnutrition. Thanks.
Thanks very much. You've given us a lot for folks to think about, and hopefully people are formulating questions for you when we come back to the general discussion. As I mentioned earlier, unfortunately, Sophia Schiff could not join us, but we'll move on to our next presenter, Natalie Pinto. Natalie is program manager for Recolto's Food Smart Cities program in Latin America. Recolto is an international network organization that works towards ensuring a sustainable income for farmers and an adequate supply of nutritious, affordable food for everyone. Their Food Smart Cities program works to strengthen this link. And I think this link between food supply, urban and rural areas is becoming an area of much greater attention, especially in countries that have a very strong percentage of their GDP in the agricultural sector. I know it's been being discussed a lot in the African continent. Natalie holds a master's degree in sustainable development from the Pantheon Sorbonne University in Paris and is currently in Quito, Ecuador. And Natalie, over to you. Natalie will speak in Spanish, and those of you who are not understanding Spanish, please push your interpretation button. You'll hear the simultaneous interpretation in English. Natalie, over to you.
Great, thanks, Joe. Can you hear me well?
Yes.
Great, wonderful. So yes, I'm going to switch to Spanish now, and I'm going to start sharing my screen. Or shall we go on this slide here, Joe?
I think that our colleague is going to claim some for you, just
great.
give me a signal.
Okay, great. Bueno, entonces,
Good afternoon for who are in different parts of the world. It's a pleasure to be here with you today. And thanks to UNICEF for this invitation on this panel on children's feeding and well-being to reduce obesity. As Joe was explaining, our goal is to improve the food environments and food chains. So they will allow the access to this food so they can be available and accessible for most of the population. And for that, and the next slide, please. We can see how do we do that. We work in different meetings. Another is with inclusive markets. So the agricultures can sell their products because they are produced in a more responsible way in different markets. We also work with public policies along with different cities to make this possible. We think that without the appropriate signs in the market and the different strategies at a public policy levels, it will be difficult to make a change. Next slide, please. So you can see the countries where we are working within the region. We are working with Guatemala, Nicaragua, and in South America, Ecuador and Peru. And we are working with sustainable landscapes, inclusive businesses, and these food systems. Maite also mentioned this, talking about interconnection between the different sectors. not only agriculture, but also environment, education, and others. And we generated evidences with other organizations, with universities, so the decision makers and the cities can include this topic in their agendas. Next one, please. And here is where I'm going to talk when we talk about food environments. I would like to talk a little bit more about good foods for schools. We've seen very good results in Belgium, and we want to also use this program in the Latin American region. Next one, please. Yes, thank you. So what we have also learned from the COVID-19 pandemic in this region is that we have adapted very easily to answer the different challenges. We've seen the information technologies, the smartphones have helped us to get close to different audiences. And this is positive, but also we know the connectivity in this region still has many gaps, and that's where we still have to work with the national government and the local governments to ensure this access to technologies, but also to quality information. Next one, please. And finally, in relation to the work that we do with children, we have been supporting an initiative of the civil society organizations, for example, in Ecuador, where they have done different talks talking about the importance of breastfeeding babies. You can see that this goes along with the pressure that was generated at work, and it's also an effort, and it is also, we have connected with different ecological producers organizations that we can see at the right side, for example. There was a forbidden to use public spaces to sell products. So this group had to get together and find a way to reinvent themselves, selling these food baskets through a virtual store, and this link that has created with mothers that it's managed by the milk bank in the city. And we have been connecting mothers with the agriculture organization so they can have access to this ecological food. So we can take care of the mothers' food that would also provide food for the babies. And these mothers will give away some breast milk to these milk banks. And another something that we're working on with Nicaragua, it's with the Union of Cooperatives of Nicaragua that sell different vegetables, and through them they are covering support for 60 schools. So we're promoting this cooperation between organizations when they start selling through different channels. For example, at an institutional level, that will be public schools, right? So with this cooperation that we're doing, we're having good results. In that particular case, this food have good agricultural practice. And I will go to the last slide just to share that we are always have great support. It's good to have allies and partners. You can see in this slide all the organizations within the cities and some other organizations in the private sector, agriculture organizations that we are working with. So thank you, Joe. That will be everything from me. And let's go back to you. Okay,
Okay, thank you very much. So let me Whoops. I have to turn off the translation so I'm not hearing myself in Spanish in my ear. So pardon me for the delay. Yeah, Natalie, you put up on the screen there. You're opening a number of questions. I wanted to ask you. You put up on the screen the multiple partners that you have, and because your group really focuses on the agriculture sector and making the connections. I want to ask you to talk to us a little bit about whether it's in partnership with other partners or with your own organization, how you work with city government in the sense that you're talking about schools, which is usually a minister or secretary of education. You're talking about sometimes I think for agriculture, especially informal spaces being made available for farmers to bring products into the city once COVID is over. Could you talk a little bit about those relationships with the organization, with cities trying to make change and trying to influence them?
Claro que sí. Gracias, Joe.
Entonces, yes, of course. Thank you, Joe. Well, I would like to show two cases. The work that we've done with a big city, like Quito in Ecuador. And for example, there, the city signed the public policies agreement in 2015 in Milan that allowed the city to have different actions. The city landed and had a strategy where we cover different aspects. One that has to do with the waste of food, another that has to do with sustainable diet, and the third one with governance. And so we work with sustainable diets, and it was defined that the city, the characteristics that a sustainable diet should have for the city. So that would mean that the food had to be close, like 100 kilometers close, that they had to be produced ecologically, or at least has some sort of certificate that would guarantee that the ecosystem that has had, and it also should be accessible, because a problem that we have in the region is that this organic food has only a niche. But what we're seeing now, one of the organizations that we're working with in the south part of the city that has a very high rate of malnutrition, they are accomplishing to have a scheme where they have they are working with close agricultures, and then they sell this to the city. So this is a model that we would like to explore more within the city, to see how the city can give incentives to these people. It's a consumer association. It's not a producer association, because sometimes we have for the producer associations or the agriculture association have different tasks: produce, distribute, and commercialize. But in this case, it's the consumer association that agrees with the producers and then establish a price that is good for the consumers, but also for the producers. So during the pandemic, some of them have lost their jobs, and also the agriculture have designed a strategy to see how they can provide this food to the families. And also now, I wanted to mention a second case very briefly that has to do with intermediate cities. Currently, we're working with FAO, the United Nations Organization for Food, and it's called, the city is called Puerto Viejo. It's my background picture. It's very interesting because in this intermediate city, we have more possibilities to activate mechanisms such as to explore the institutional purchase of food for schools. So another NGO, it's working to determine a list of agricultural organizations that could provide schools within the city, this intermediate city, where we see a possibility that will be faster in time, and they are close to the authorities. So it's something interesting, and we hope to see, by working with the city, a possibility to improve their mechanism of public purchases with the schools, because they have serious obesity problems. So it's interesting to mention, maybe the panelists can also comment later, is that yesterday when we were talking with a nutritionist in the city, where they were saying that that this city, after an earthquake and the COVID, the malnutrition rates has not increased. Actually, it has improved, thanks that the municipality put into practice some programs, some modules for school feeding virtually that will work together with the parents. And this gives us a clue that it's an adequate policy that was applied by the Puerto Viejo municipality.
That's great.
Thank you.
Really
Es
important
genial,
issues, and I think the
son temas
dynamics of
muy
working with
importantes y creo
cities
que la
are
dinámica de trabajar
particularly
con las
challenging.
ciudades son
Let me ask
bastante
you one more
desafiantes.
question.
Déjame hacerte una
Just
pregunta más.
what do you see as the
¿Qué es lo
strengths
que
of
ves como las
connecting up to an
fortalezas de
organization like
conectarse con
UNICEF
una
and
organización como
partnering
la
with them in
UNICEF y
your
asociarte con
work? Can you
ellos
be a
para
little
tu
more, give us a little
trabajo?
bit more
Quizá
detail
nos puedas
about
dar un poco
what
más de
UNICEF
detalles
brings
sobre qué es lo que
to the work
trae
and
UNICEF
how
a
you
tu
kind of see this
trabajo
partnership going
y
forward?
cómo ves esa sociedad de aquí en
Yo
adelante.
creo que es
Of
importante,
course,
¿no?
I think
Trabajar
it's
de la mano con
important to
UNICEF
work together with
porque trae
UNICEF
todos ese
because it
expertise
brings
del
all
trabajo
its
con niños,
expertise
pero también con las mujeres,
of
¿no?
their
Yo creo
work with
que
children, but
los
also with
aportes
women.
que
I
también
think
trae UNICEF
what
en
they
términos de
bring
la política
UNICEF
pública
when we talk
diferenciada,
about
¿no?
public
Con enfoque de
policies
género, con atención a
with a
los
gender
cuidados,
approach,
es muy importante porque
addressing
esto aporta
these
a los
kind of topics,
planificadores de la ciudad a tener
that this
otra
will
mirada
bring
de
ideas for
cómo
the city
integrar
planners, a
diferentes
different idea on
usos
how to
en
integrate
el
different
espacio
uses
público, ¿no?
within
Por
public
ejemplo, la
space.
importancia
For
que tiene la
example, how
agricultura
important
urbana
it
en
is
las
for urban
ciudades para
agriculture
conectar
in
a
the
públicos
cities
diversos,
to
¿no? Las
connect
huertas
different type of
escolares también es otro
publics, no?
ejemplo
For
que
example,
conectan
this is
a
a very
los
good
niños
example
con
that
los
will
padres de
connect
familia y nuevamente
children
vamos
with
reconectando
parents
con lo esencial que es
and
el alimento. Entonces yo creo que hay
and
UNICEF
also brings
y
this
con todos los
message about
módulos
food
que
and
ha
with all
venido
these
desarrollando, ¿no?
modules
Como lo
that
que
they
nos
have been
presentaba también
developed,
ya anteriormente
as I
Mike,
mentioned before,
sobre
as Mikey
cómo se
also
alimentan los
mentioned,
niños bien en las ciudades, por qué es
how children
importante
in cities
tener un alto índice
eat.
de
So why
verde
it is
urbano en las
important to
ciudades,
have
etcétera. Yo
a
creo que eso va a
high
ser muy
urban
importante en
index in
términos de
cities.
construir
So I think
resiliencia
it will be
y
important to build
aportar
resilience and
a
to
reducir
bring
el tema de la
this
obesidad.
idea to try
También
to
creo que otro
reduce
tema
obesity. And
importante
I
y
think
en
another important
colaboración entre
topic,
las
and that
agencias,
in
¿no? Por ejemplo,
cooperation within
UNICEF, el
the
Programa Mundial de
agencies between
Alimentos,
UNICEF,
la Organización
the
Mundial de
World
la
Food
Salud,
Program,
es la
the World Health
implementación de las
Organization,
guías alimentarias, ¿no? De
is
las
the
GAP,
production of the GABAs,
¿no es cierto?
the
Dietary
alimentary,
Guidelines
the
Based on Nutrition,
dietary
porque
guidelines on
ahí
nutrition,
es un instrumento muy
because this
potente,
is
¿no? En
a
el que
very
trabajan
powerful
Naciones Unidas
tool
y que se
from the
puede
United
poner
Nations
en
that
marcha
can
en
put
alianza
into
también con el
practice
sector privado, ¿no? Es decir, por
in an
ejemplo,
alliance
el
with the
sector
private
OECA, todo el
sector, no?
sector de la
For
restauración,
example, all
de
these
los restaurantes,
tourism or
ahí es donde
restaurants
también se puede
sector,
contribuir,
that's where
¿no?
we can
Para
also
mejorar el
contribute
entorno
to
alimentario
improve
de
the
los espacios,
food
pero también a nivel
environment
de
of the
información y
different
de
sectors,
comunicación,
but
que eso
also
creo que es
at the
algo que
level of
también
information
UNICEF,
and
¿no? De lo que yo conozco, he
communication.
visto que puede
And
ser
I think
muy
UNICEF can
importante para
also
contribuir,
be
generar una
an
nueva
important
o
partner
reconectar
to
con una cultura
generate
alimentaria
and to
sana,
reconnect
¿no?
with
Que
this
sea culturalmente
healthy
apropiada.
food culture that is culturally appropriate.
Great, thank you. Terrific. Again, very rich set of responses. Lots of things we may want to go into a little bit later in the discussion. So our final speaker today is Dr. Iliana Curiel Arismendi, who is the Director of Collective Health for the District Secretary of Health in Bogota, Colombia. She's coming in just at the right time because we're opening up questions about interaction with government and political leadership. She has 10 years of experience within research and social and intercultural interventions to improve nutrition and health of children, and served as president of the Committee on Adolescence within the Latin American Pediatric Association before stepping into her role as District Secretary of Health. She's worked actively with multiple civil society organizations, indigenous communities, and obviously has received many awards. And she's a medical doctor specializing in pediatrics with a master's in public health from the University of the North in Barranquilla, Colombia. So over to you, Dr. Curiel.
Good morning. And thank you
Hola,
very much
buenos días
to the
y muchas
organizers of
gracias a
this
todos los
event to give me
organizadores
the
del evento por
opportunity to
la
co-create
oportunidad
and to
de
continue
co-crear
learning all
y
together on
de
this
seguir
important
aprendiendo
topic
juntos en este tema tan
for
importante para la
infants and for
primera
people in
infancia
Latin
y para la
America.
niñez de Latinoamérica.
So the presentation is going to be
Pues
focused on
la
the
presentación va a ir
actions on
enfocada a las
healthy
acciones
food
en la
on
alimentación
the
saludable en la primera
infants in
infancia en
Bogota. We're going to
Bogotá.
talk about three main things.
Vamos a
One is
hablar de
how
tres
we are
cosas
doing today.
principales.
Two,
Uno,
what are
cómo
the
estamos
actions
ahora.
that we have been
Dos, cuáles
doing
son las acciones que venimos
within our policy
realizando
framework,
en el marco de
and
nuestra
how
política
these
y
actions
cómo
have been
esas
performed
acciones
thanks to
las
different
hemos realizado
alliances. And
gracias
last
a
but not
diferentes
least,
alianzas.
we're going
Y
to
por
talk about the
último,
challenges,
terminar con los
talking
retos,
about
¿no? En
the
relación a la
current
situación
situation about
actual
malnutrition
de la malnutrición
during the first
en la primera
ages here in
infancia en
Bogota.
Bogotá.
You
Bueno,
can
pues
see
esta gráfica muestra
how
realmente es el
behind our
retraso en talla,
children
¿no?
in height.
Cómo ha venido
A
aumentando. Sabemos
child,
que
when
un
you see
niño
that it's behind in
en el
his
que
height,
vemos
you
un
can see
retraso
that
en
there is
talla
a
habla de
chronical
una
issue in
cronicidad
their
en la alimentación,
eating.
¿no?
We don't have the
Sin
data
embargo,
here, but I can
no
talk
está
about two
aquí el
important
dato,
things for
pero
Bogota.
quiero hablar
One
de dos cosas
is
importantes
that
para
the
Bogotá.
current
Uno,
situation
que
and
es la
malnutrition
situación
per
actual y en la
deficit,
desnutrición
where
por
we have
déficit, en el
had an
que
improvement
hemos
throughout
venido
time.
mejorando en
Before we
una
were in
serie
a
de tiempos.
7%,
Antes
and
estábamos en
it
un
has
7%
reduced in the
y
last
hemos
10
venido
years to a
disminuyendo en los últimos 10 años
3.7%.
hasta un
So our
3,7%,
children
¿no? Entonces,
that
nuestros niños
had acute
que venían siendo
malnutrition,
desnutridos agudos,
that number has
esta serie
reduced,
ha
but it's
venido
also
bajando,
important
¿no?
to
Pero
mention
es
that
importante mencionar
malnutrition
que
per
en la
excess,
desnutrición, en la
it's the
malnutrición por
opposite.
exceso
So
es
malnutrition
todo
per
lo
excess
contrario,
in
¿no? Entonces,
Bogota
la malnutrición
has
por exceso
increased.
en Bogotá
And
ha
something very
venido
peculiar
aumentando y
happens.
ocurre
Children
algo
under
muy
5,
particular, ¿no? En los niños menores de
in
5 años,
time, it has
en una
increased
serie en
in
tiempos ha venido
3.6%
aumentando
to almost
3,6% a
5.1%.
casi
But when they end
5,1%.
up this
Pero cuando
first
termina justo su primera infancia y
infant and
pasan
then
a
go
la edad
to school,
escolar,
it
aumenta
increases to almost
exponencialmente a casi
8.8%,
8,8%.
with an increase
Tenemos
in their
niños en
weight
exceso de
and
peso
obesity.
y en
So if
obesidad, ¿no?
we
Si
add up both
utilizamos y
formulas
sumamos las dos
on
formas de
obesity and
exceso de
excess of
peso,
weight,
sobrepeso y
we are
obesidad,
on the
estamos casi en el 90, en el
29% of
29%
children. So
de
I
los
think it's
niños,
an
¿no? Entonces
important
creo que
topic
es un punto
to
importante
intervene.
para poder
Thank
actuar e
you.
intervenir.
So
Siguiente.
I want to
Entonces,
focus, next
quiero
slide, please.
enfocarme,
I
siguiente
want to focus
diapositiva, por
on
favor.
what are the
Entonces, quiero
actions that
enfocarme en
we
cuáles son las
are
acciones que
putting
estamos
into
haciendo
action,
relacionadas a nuestra
talking
política
about
pública de seguridad
building citizenship. Our
alimentaria
main
construyendo
objective is
ciudadanía, ¿no?
to
Nuestro objetivo principal es poder
to
superar
address
de
the
manera progresiva la
malnutrition
inseguridad
of the
alimentaria y la
inhabitants in
malnutrición de los
Bogota. We have three
habitantes de
specific
Bogotá.
objectives to
Tres
be able
objetivos
to influence
específicos pueden
situation of
incidir
economic and
en
social
situaciones de
inequality that
inequidad
affect food
económica
and
y social
nutritional
que afectan la
sovereignty
seguridad alimentaria y
in
la
Bogota, to
soberanía
be able to
alimentaria y
consolidate the
nutricional,
health, food
poder
supply and
consolidar un
distribution
sistema de
system,
abastecimiento y
and to
distribución de
encourage
alimentos
responsible
saludables,
consumption of
incentivar el
healthy
consumo
food and also
responsable de
healthy
alimentos
practices
saludables, así como
at
también
all
prácticas de
ages, and also
alimentación,
physical
nutrición
activity.
y actividad
Different
física.
actions
Varias acciones, sobre
that
todo
were visible
que pudieron visibilizarse
in
en
last
el
year
marco
framework, especially during the
del año
pandemic, to
pasado,
be
sobre
able
todo en la
to
pandemia, ¿no? Poder hacer
identification
gestión
of
para
vulnerable
vincular casos
cases and
vulnerables
link
y
them
poder
to
identificarlos
social
y trabajar de
programs,
manera
and to
articulada
work with
con
other
otros
sectors
sectores
of
de
the
la
city
ciudad, o
with
sea, con integración
social
social,
interaction,
con
with protection,
protección,
employability,
también con
entrepreneurship,
empleabilidad,
also
con
to be able
emprendimiento, también poder
to
gestionar y
improve
vinculación de casos
the
vulnerables y poder
availability and
incluirlos
consumption
en
of
programas
healthy food,
sociales, implementar
promotion
programas
of
para
healthy
mejorar la
eating and
disponibilidad y el
breastfeeding,
consumo de
and
alimentos
also
y como
the
último, pues el
creation of
diseño e
healthy
implementación de piezas
environments and
comunicativas
to
para poder
promote
promover la alimentación
healthy
saludable, la
eating
lactancia y la
in these
implementación de este
different
tipo de entornos.
landscapes.
Siguiente
Next
diapositiva,
slide,
por favor.
please. It is important that
Es
within
importante
the
que
framework
en el
of
marco
implementing programs
de
to improve the
implementar programas
availability and
para
the
mejorar la
consumption of healthy
disponibilidad y el
food,
consumo de alimentos
we had
saludables,
a very important alliance
tuvimos
where
una
we were
alianza
able to
muy
determine
importante en
how
el que pudimos
the food
determinar
landscapes were
cómo
in
estaban los
Bogota.
paisajes
We align with
alimentarios en
health,
Bogotá en una alianza con GEL.
and there are many
De
challenges
verdad que
that
hay
affect
muchos
the food
desafíos, ¿no? Que afecta el
behavior in
comportamiento
some neighborhoods within the
alimentario
city.
en algunos
Bogota, it's the capital
barrios de
of
la ciudad.
Colombia.
Bogotá
It's a
es la
city
capital de
that
Colombia,
has
es una
almost
ciudad de casi
7.1 million of
7,1
citizens
millones de
with a moderate
habitantes, con una densidad
populational
poblacional
density.
moderada de
And
44
it's
habitantes
the
por kilómetro
capital of
cuadrado.
Colombia
Y es
where
la,
we
la
receive
capital
a
de
lot of
Colombia en
population
donde
many
llega mucha
children as
población
well.
y
So
muchos
it's a
niños también, ¿no?
multicultural
Entonces
city. We
es
have
una ciudad
different ethnics,
multicultural, hay
different
diferentes
cultures, different
etnias,
identities.
identidades,
what we did in this work with health, we located 4 areas of Bogota that were located strategically: Paraíso Norte en Puentes, and El Porvenir en Paraíso Sur, 4 different areas with 64 volunteers. We did an intervention in 64 places, and we found different characteristics in each area. They were located in the outsides of the city. The neighborhoods had differences. Talking about their food experiences, they had insecurity. The topography was complex. We could see some where people, they didn't have a very easy walkable land. In other neighborhoods, it was more easy for them to have resources and different options for food in the public space. So what were we able to see is that in these places, the public space, it's a big challenge to eat healthy. There are many ultra processed products that are dominant, and we can see them at the stores. The access is limited for fresh products, and the places for food, they don't have basic services. So when they see this street food, there is like an insecurity there. Next slide, please. What we found there. Next one, please. 3 out of 4 people in some areas, especially in the south, they were eating at home, or they eat at home. That's their daily experience. Next slide, please. So the neighborhoods offer different gastronomic experiences for the citizens. It's important to mention that there are neighborhoods that are very different on the food quality and the public spaces. Many people, 40% of people, travel more than 60 minutes daily, and that creates this dynamic in the public space where they usually eat. But here, the food is not healthy. In a 75%, it's an offer of ultra processed food. So I guess there are many points that we need to intervene in this case. Next one, please. What do we learn from this job? To be able to understand 6 pillars, to have a healthy food landscape. First, to be able to group key routes or healthy paths or safe routes. Then we need to have an identity. Colombia, it's a multicultural country, so we need to create identity with culture, with routes, or with culinary rituals. No, someone eats at a beauty salon, and that's her daily routine. The food culture, or the super ladies that can teach us what to cook, some food places, some daily rhythms to try to feed in their daily routines for people to have access to the food, maybe to expand micromobility, to bring food home, and to reduce intermediaries in the supply chain, and also could be deliveries, to support these local stores, to make it a more nice areas. So as a result of this great alliance, we have this path where we still need to implement different things that could help us to provide a different offer for food for families. Next one, please. So what are the other actions? Some collective actions is to strengthen the knowledge and the capacities of the health personnel on breastfeeding and women and adolescents, information, education, and communication in food and nutrition security, to promote strategies for coping with food insecurity, and also social networks to support healthy eating, with emphasis on breastfeeding. Next slide, please. And some individual actions. We have another possibility here, and it's that next slide, please. The actions, the individual actions, are related to the individual care that we provide for children and adolescents. So we have the route of Bogota for children under 5 that have some nutritional issues. We have trainings. We want to have hospitals that are friendly with children.
y seguimientos a
and
cortes de niños
also
con
health interest
eventos de
public
interés en salud
events.
pública, ¿no?
These are the goals that we have
Estos son
established
como las
in the
metas que nos hemos
different
creado
plans
en
and
los diferentes
intervention
planes
plans.
de
But what
intervención.
calls my
Pero,
attention
¿qué
here
quiero
that
llamar
these
la
are
atención acá? Que
alliances
estas son
and there
alianzas
are country
y son
regulations. We have
normas
a
de
route
país.
to provide
Tenemos una
comprehensive
ruta para
care for
atención
children with
integral a niños con
malnutrition that is
desnutrición,
implemented,
¿ya? Que está
but we don't
implementada,
have
pero
a route to
nosotros no
provide
tenemos una
comprehensive
ruta
care
para la
for
atención
children with
integral de niños con
obesity and
sobrepeso y
overweight.
obesidad,
So all
¿no?
the
Entonces,
strategies are
todas las
focused
estrategias
on
y los programas están
malnutrition for
enfocadas
deficit,
a la
but not to
malnutrición
malnutrition
por
for
déficit y no
excess.
tanto a la
And those are
malnutrición
the new
por exceso,
dynamics
y
that
esas
we
son
have
las
to
nuevas
address
dinámicas en
now.
las que tenemos que
Just to
verla acá
close,
ahora, ¿no?
what are the
Ya para terminar,
challenges,
¿cuáles son los
the
retos
main
y los grandes
challenges for
desafíos?
us in
Entonces,
Bogota?
para
Next
nosotros
slide,
en
please.
Bogotá,
To strengthen
siguiente
all
slide,
the
por favor.
actions
Fortalecer pues todas las
on
acciones de
breastfeeding and
consejería
infant
en
feeding,
lactancia
starting
materna
from
y
the
alimentación
gestational
infantil,
stage,
iniciando desde la etapa
to provide
gestacional,
timely and
un
integral
seguimiento integral y
attention to
oportuno de las
identify
alteraciones
malnutrition
nutricionales durante
cases.
la primera infancia.
It's
Es muy
very
importante, y
important.
esto
We
lo
see in
vimos en
Bogota
una
during the
experiencia de
pandemic
Bogotá
that
en la
the
pandemia, que la
articulated
intervención articulada de
intervention
seguridad alimentaria y
has to
nutricional
include other
debe
government sectors, to the
incluidos a los
family
otros
and
sectores del gobierno,
society,
a la familia y
to
a la
be
sociedad.
able to
Poder
certify
certificar
institutions with
instituciones
better
con mejores condiciones
situations
para
to
la
provide
atención a la
care
población
for
materno-infantil.
children.
La base siempre va a ser afectar los determinantes estructurales relacionados
Especially
con las
with
mejores condiciones
influence
laborales y
social
ejercicio de la
determinants on the
maternidad
exercise of
y la
motherhood and
lactancia materna,
breastfeeding, to
promover
promote
hábitos
healthy
alimentarios
eating
saludables y
habits,
crear
create more
conciencia sobre la
awareness on the
relevancia de
relevance
la
of food
calidad de los
quality at
alimentos
all
en
ages.
todas las edades.
Because
O sea,
a
el
child that
niño que
does
no
not
come
eat
bien en
well
sus primeras
at an
etapas
early age
probablemente
is going to have
vamos a
some
tener un
chronic
adulto
issues that
con condiciones
we're going
crónicas
to
que
see
vamos a tener que
later.
intervenir.
That's
Muchas
everything for
gracias.
me today. Thank you very much. Muchas
Thank you
gracias,
very much, Dr.
doctora
Curiel. Let me
Curiel. Déjenme
begin by
empezar haciendo una
asking you
pregunta. Usted está
a
en Bogotá,
question.
sabemos que es
You
una de
are, I
las
think Bogota
ciudades
is one of the
en este
cities in the
programa
global cities
del
changing
cambio de
diabetes
diabetes.
program.
Quería utilizar esa
And I wanted
oportunidad
to
para
use
hacerle
that
algunas preguntas sobre
opportunity to
trabajar con el
ask you a
sector
little bit about
privado.
working with the private
¿Cómo ha
sector.
sido eso? ¿Ha habido
How has that
problemas? ¿Han
been?
habido
Have there been any
desafíos? ¿Han
issues,
habido
challenges,
oportunidades? ¿Podría hablarnos
opportunities? Could you talk a little
sobre la
about
ciudad
cities
cambiando la
changing diabetes
diabetes?
is, as I
Es
said
una
earlier,
iniciativa
a
global de la
global
compañía de Nova
initiative of the
Nordisk
Novo Nordisk company,
que
and
ha
has
creado muchas
raises the
preguntas
sort of
en
question,
muchas
I think in many regions,
regiones, la
governments collaborating
colaboración
with the
del
private
gobierno
sector
con
has,
los
has
sectores
been
locales
evolving,
ha
shall we
generado
say, but
muchas
it
preguntas. Me
raises
gustaría
issues.
que
So
hable
I'd
un
like
poco
you just to
sobre su
talk about
experiencia
your experience of that
y el
partnership
consejo que le podría
and
dar a algunas
advice that
ciudades
you
que
might
tal
have for
vez
other
se van
cities
a
that are
conectar
thinking
con el
about
sector privado también.
connecting to the private sector.
Yes,
Claro
of
que
course.
sí.
I think
Yo
there are
creo que
many
hay muchos juicios
still
relacionados a las
doubts on the
alianzas
alliances with the
público-privadas
private sectors. I have to be
tengo
honest,
que
at the
ser
beginning,
honesta. Al
we had many
comienzo
fears,
eso eran como
but
muchos temores, ¿no? Pero
to be able to
realmente
organize
como poder
administratively
organizar
this
administrativa y
alliance, it's very important
jurídicamente la
to move
alianza, eso
forward.
es
But the
importante
experience
para
with the
avanzar.
programs,
Pero la experiencia con el programa
change,
de
city
Ciudades
changing
Cambiando la
diabetes in
Diabetes en
Bogota,
Bogotá ha permitido
we have been able to
identificar
establish
realmente
links
vínculos de sistemas
with
alimentarios
the
con el
urban sectors
entorno
and the
urbano
people
y los hábitos
eating
alimentarios de
habits
las
and to create
personas. También
strategies
poder
and
crear
interventions
estrategias
to
e
create a
intervenciones
positive
para
change
lograr un cambio
on the
positivo hacia el
food
comportamiento
habits on
alimentario
people
y
and to provide
definitivamente
access to
mejorar el
natural
acceso
food
a alimentos
and also
naturales,
healthy food
especialmente
like
a
fruits and
saludables
vegetables.
como
So it's
frutas y
been a great
verduras. Ha
alliance
sido
that had
una
strengthened
excelente
us
alianza que nos
to
ha
the government and has
fortalecido
allowed us
al
to move
gobierno,
forward
que nos
to
ha
have a
permitido
better urban
avanzar hacia
governance.
tener una mejor gobernanza urbana.
Second,
That's great. And I know there's a lot more to talk about in that space, but I want to ask you one other question. Obviously, as a city official in the capital city of a country, one of the questions is what kind of interaction on this specific issue really of obesity and food and nutrition with national government? Are they supportive? Are there policies at national level that support the work that you're doing, or are you really pioneers in opening up this area of attention to nutrition for the overall national government?
Sí, de pronto creo que me hizo falta contestar
maybe
la segunda pregunta, la
I
segunda
should have
parte de la primera
answered the
pregunta, y
second
era qué
question or the
aprendizaje
second part
podía
of the first
transmitir
question
a
that it
otras
was that
ciudades, ¿no?
what are the learnings that I
primero,
could
la
pass to other
posibilidad
cities?
de abrir a tener
First,
esas
the
alianzas estratégicas que
possibility
permitan
to have
visibilizar
these
todas
strategic
las
alliances that would
acciones
allow us
que
to
nosotros hacemos. Creo que
visibilize all these
lo más
actions, to
importante
make
es
visible
que
all these
cuando usted
actions that we
trabaja
have.
para
The
la
most
seguridad
important
alimentaria y
is that
nutricional
when you
y
are
para la salud y
working
bienestar de niños y
for
niñas, no
food
pueden
safety
enfocarse
and for
solamente en lo que
nutrition
el
and
niño
for the
come,
well-being
¿ya?
of children,
Sino
you cannot just
también
focus on when the
en los
child eats.
determinantes
You
sociales
also
que
have to
inciden
focus on
de una u
the
otra
social
manera en la
determinants
salud y en el bienestar. Y
that also
creo que eso ha sido
influence in
la
some
parte
way on
más
the
importante
well-being and health.
y
And I
son
think
todas
this
las
has
acciones
been the most
intersectoriales
important
que se
part
generan cuando
and are
usted
all the
se
intersectorial
dedica a
actions
trabajar
that
en la
have been
primera infancia.
generated
Con relación
when
la
you're working
segunda
on
pregunta
the first
de
stage of
cómo veo tal
childhood,
vez la
in relation to
relación
the
entre el
second
gobierno
question,
local y nacional,
how do I
para
see
tener un
the
poco más
relation
de
between the
contexto,
local government and national government?
Bogotá
To have a little bit
internamente
of
tiene
context,
20 localidades.
Bogota
De esas 20
internally
localidades
has
hay unas
20
áreas que son urbanas y unas
municipalities,
áreas
and
que
within
son
these
rurales.
20, we have
Cada una de
urban
estas
areas and
localidades
we have rural
tiene un
areas.
gobierno
Each
local
one of these
que es antes se le
municipalities
llamaba
has a
el
local
alcalde menor, ¿no?
government
Entonces,
that used
qué
to
quiere
call
decir eso? Que
the
la
minor
articulación que
mayor.
desde
What
la
does that
alcaldía o
mean?
desde la
That the
Secretaría Distrital de Salud
articulation
se haga
from
con estas
the mayor or the
localidades
district
es importante
secretary
para poder
that has to work
bajar
with
la
these
política y poder
municipalities. It's
co-crear y poder
important
tener
to
una
reduce
participación
policies and to
comunitaria
be
y
able to
entender la
co-create
dinámica del
and to have
territorio
a
para tomar
communitary
acción. En
participation and to
relación
understand the
a si
dynamics of the
nosotros
territory
tenemos una
to
política
have
que es la política
actions.
nacional,
So we
lo
have
acabo de
this
mencionar,
policy that is
tenemos
the national
acciones y
policy, and I
políticas
just mentioned
relacionadas a
it.
la
We have
malnutrición por
actions
déficit.
and
Muy
policies that are
pocas
related
medidas
to
hay en la
malnutrition per
malnutrición por
deficit,
exceso. Y
but
creo que
very few
de
for
allí Bogotá ha
malnutrition per
tenido
excess.
grandes experiencias.
And
Estamos
that's why
avanzando en
Bogota
nuestras
had
guías,
very
en las guías
many
de
experiences.
Bogotá
We are
y
working on our
lineamientos y las
guidelines
orientaciones para poder intervenir
and the
la obesidad
orientations to be able to
infantil. Entonces,
intervene
sí creo que allí
a
toca
childhood
unirse más
obesity.
para
So
que
I
desde
think
el gobierno
it's
nacional se
important to
puedan
get
crear
together
actos
the national
normativos que
government
puedan
so
intervenir
we
de
can
otra u otra
create some
manera
regulations
ya a las
to
diferentes
have an
zonas, ¿no?
intervention in some way in the different areas.
Terrific, thank you. We'll come back to that, I'm sure. Before I let you go, for this
Muchas
segment
gracias.
of the
Vamos a volver
discussion,
a
there's one
eso.
specific
Antes
question for
de
you
terminar con esa
from
sección, hay una
Leticia
pregunta específica
de
para
Oliveira de
usted
Cardoso.
de
She'd
Leticia
like to know
de
if there
Riviera
are
de
any
Cardoso.
empirical
A ella le
studies
gustaría
published that
saber
show
si
the
es que
effects
hay
of
algunos
your
estudios empíricos que
neighborhood
se hayan publicado que
interventions
muestran el
for the
efecto
community,
de
changing
las
the community food
intervenciones de los
environment around
vecindarios
schools in
para
Bogotá.
cambiar la comunidad o el ambiente alimentario de estas comunidades en Bogotá.
No, el estudio que yo acabo de presentar es
No.
una primera parte,
The study
¿no?
that I have just
Le
presented,
llamaríamos
it's
una
the first part.
caracterización de cómo está la
We will
dinámica
call
o
it
los
like a
paisajes alimentarios en
characterization of
Bogotá.
how is
Las
the
6
dynamics of the
estrategias
food
son la
landscapes in
implementación
Bogotá. The
de
6
pequeños
strategies are the
pilotos que nos van a
implementation
permitir avanzar.
of
Entonces,
small
todavía
pilots
no está en
that would
implementación.
allow us to
Nosotros
move
tenemos unas
forward.
acciones
So it has not been
estratégicas y
implemented
esas
yet.
acciones estratégicas
We
sí
are working on
nos
the
muestran
strategic
resultados de cómo las
actions
dinámicas
that is
en el
showing us
entorno
how the
educativo ¿ya?
dynamics in
Pueden
the
incidir a una
educational
seguridad alimentaria.
environment
Pasó algo muy bueno
can
con la pandemia. Las estrategias de
have a
información,
consequence
educación y comunicación,
on the food
teníamos una barrera
environment. We
en
have
el
something with the
entorno
pandemic.
educativo
These
para poder hacer
strategies that we needed
conferencias,
to
trabajos con los
apply
niños,
became
pero
a
la
barrier.
virtualidad
We
permitió
couldn't have
llegar a las
conferences
familias que
for
estaban
children,
apoyando
but
a
the
los niños
virtuality allows
en
us
su educación
to
virtual.
reach
Y allí
families
nos
that were
fortalecimos
supporting
mucho
children in their
en
virtual
trabajar y en
education.
avanzar
And so it was
prácticas
a strength
alimentarias
for us
saludables hacia
to
las familias,
work
hacia los niños con
on
algunas
healthy
actividades de
habits for
acompañamiento
families, for
psicosocial
children.
y
We did
emocional.
some
Entonces,
activities
sobre
on
esa experiencia
psychosocial and
sí
emotional
es muy
activities.
buena. Pudimos llegar a casi
On
el
that experience,
70%
it
de
was
los
very good. We
hogares
were able to
aprovechando
reach almost
este espacio de la
70% of
virtualidad, ¿no?
homes
Muchas gracias.
through this virtuality.
That's great. I think you have an audience already for your publication. So hopefully either formally or informally, perhaps as part of the information sharing that the Cities Changing Diabetes program does. So thank you for your rich responses. I'm now going to sort of create a little bit of a break here between our individual panelists and moving on to general discussion. We have a video which was created by the GAL organization. Unfortunately, our speaker wasn't able to join us, but I think you'll get a sense of how they involve young people in thinking about and changing the food environment in cities. So if we could go to the video.
So when we started working in London, we had this hunch, and our client did too, that like the built environment made a difference in some of the behaviors that they saw. And this was in neighborhoods where over 50% of the kids were obese. And so, you know, we've learned from them, from spending a lot of time with kids, that it's the public space, it's the shape and dimension of the street and access to public transit, it's the life, the things that are happening there, and then it's the actual food place itself.
And it's cheap.
The signage of it, the transparency, how it speaks to kids.
There's not even seats in there, and everyone always chills in there. Everyone goes to.
Before we did the study, I've always been thinking that the reason why fast food places were successful was because they were super good at serving fat, salt, and sugar to the people in an economic, accessible way. But after doing the study, I actually understood that it's much more brilliant, the invention. So they're actually quite good at actually offering what young people need today, except for actually getting served. And normally you would think that there should be some kind of difference between London and Copenhagen, but when it comes to foodscapes, there's not any difference at all when you see it through the lens of young people. We talk about the fact that the food system is not visible to people, but most of the consumption of the food is actually going on inside the city. It became obvious that if you want to change the system and change the everyday lives of people, we need to talk to architects about it.
Great, thank you very much. That's a really good example of the work. I've had the pleasure actually of being part of an assessment of foodscapes in New York City with the Gale Company organization. I encourage you all to take a look at their website. It's a very, very interesting one. It has a lot of tools for people really looking at engaging community and thinking about environmental change. So let me invite our panelists to put their pictures on. I think they're the ones that we need to be able to question, both from my questions from what was happening, and also from those in the audience. Maybe Iliana and let's see, Iliana and Natalie. Could we ask you to put on your picture? There we go. Dr. Curiel, could we get you to put your picture on? There you go. Thank you so much. I appreciate it. Let me start by asking each of you to take a look. We've talked a lot about, obviously the focus of this session is on food and the food environment, but each of you have touched on the importance of exercise. And had we had a presentation from our colleague from Gale, we probably would have not only looked at the issues of marketing of foods, as we saw in the video, but also the challenge really of changing the physical environment in terms of parks, in terms of bike lanes, in terms of pedestrians, et cetera. I know Bogota is kind of a global leader in looking at the transportation sector as a way of promoting active, greater activity, greater levels of activity. And I'd just like each of you perhaps to comment on the sort of the connection between the food environment and exercise in the work that you're doing, what opportunities you see, what you may be doing. Let me start with Dr. Curiel, Liana, if I may, to ask you in the city, how are you putting these pieces together? Because obviously it all comes to your desk in the end. So then we'll go to our other panelists. Dr. Curiel?
Doctora Curiel.
Hola.
Hi. Yeah,
Sí, claro que
of
sí.
course.
Bogotá tiene
Bogota
espacios
has
de articulación
spaces of
intersectorial,
intersectoral
por decirlo de alguna
articulation, to
manera,
put
en
it in
donde
some way, where
ponemos
we
líneas y
put
actividades y
lines and
planes de acción
activities
que
and
están
action plans that
relacionados
are
con
related
varias
to
dependencias
different
del gobierno.
government dependencies.
Particularmente la que mencionabas,
Particularly what you
nosotros
mentioned,
tenemos
we
una
have
que es
one
cómo
that
apoyar
is
la
how
seguridad
to
alimentaria y
support
nutricional, pero
food
la
security,
conectamos con
but it's
actividad
connected
física
with
y también
physical
con salud
activity and
mental,
also with
¿no?
mental
Entonces,
health. So
trabajamos
we
esos
work
tres
those
puntos, ¿no?
three
Entonces,
topics.
desde la
So
Secretaría de
from the
Movilidad,
mobility
entonces me voy en
secretary,
bici o voy en bici al
for
colegio,
example,
son
I take my bike
espacios
to go to
para
school.
los chicos,
We
para
have
los
these
escolares,
spaces
en donde
for
además de la
school, boys and
actividad
girls to
física,
promote
se
physical
realizan
activity.
actividades de
We
promoción de
have
hábitos saludables, ¿ya?
activities to promote healthy
También es
habits.
importante
It is also
que
important to
en el
mention that
marco de
within
cada
the
una de estas se
framework
ha
of these
demostrado pues la relación que
activities, we have
existe
showed
entre
the
actividad
relationship
física
that we
y
have between
salud mental. Entonces, no
physical activity
solamente
and
para
mental
los
health, but
niños,
not
sino
only for
también para
children,
la
but also
familia,
for
¿ya?
families.
Entonces, hay
So
espacios
we have these
de la Secretaría
spaces
de Cultura,
within
que es el
the
Instituto de
Culture
Recreación y
Secretariat
Deporte, en donde
for
tenemos
sports
parques
and
saludables,
health, where we
entornos
have healthy
dentro de la
parks,
ciudad que
environments
han
within
sido
the city that
adaptados
have
para
been
poder
adapted to
propiciar
promote
cada una de estas
each one of these
actividades.
activities.
Entonces, ¿en qué
So
sitio se unen cada una de
where
estas
do we
estrategias?
connect these
En un
strategies?
comité
We
que
have this
tenemos que se llama
committee
Comité
that is an
Intersectorial de Salud,
intersectorial
y ahí
health
confluyen
committee
cada una de las
where all
dependencias y
these
tenemos un
dependencies
plan
come
de acción.
together,
Ese
and
plan
we
de
have this
acción está
action plan
relacionado
that
en
is
un gran pilar
related in a
que se llama
greater
seguridad
pillar that is
alimentaria y
food
nutricional
security
e
and nutritional
incluye
security,
no solamente las acciones que
that includes
realizamos
the
para la salud
actions that we
mental de
perform
niños, niñas y
for mental
adolescentes,
health
sino
of
también
children and
con enfoque de
adolescents,
enfermedades
but
crónicas, y
also
allí
for
también
chronic
toda la parte
conditions,
de actividad física.
and also
Muchas
includes
gracias.
everything that is related with physical activities, of course. Thank you.
Thank you for your answer. Let me go to Micah now and ask you. I know you talked about an initiative with the Healthy Cities for Children that obviously brings a lot of elements together on health with the nutrition focus. Could you tell us a little bit about how you connect the dots between education and space design and nutrition?
Right. Yeah. Thanks a lot. And Bogota is also one of the cities that we're working on, child-friendly cities. But also more broadly, I think what is important in terms of physical activity is that it starts early in life, and that play, that it is part and parcel of children's routine from the get-go. And we need to do, we invest as UNICEF a lot also now in parenting skills. And of course, digital tools are useful for a lot of things, but they also keep children sometimes from the active play. So we actively promote in our work on early childhood development, in cities and more generally, we really promote, play and all kinds of physical activity that children can do. Of course, like Dr. Curiel said, yes, there's also a very important link with mental health on the prevention side. So another reason why we need to keep that, and also that we need to support, families, throughout the life course, because of course modeling, when parents move, when they use active forms of transport, when they play, when they exercise, that is also a very important model for children. I want to mention one very specific issue that we've noted in the context of COVID-19, and the pandemic is still very, very much, alive, unfortunately, in this continent. We're still, I think, the epicenter of that epidemic, and a lot of the quarantine measures and the lockdown measures that have been implemented also severely restricted people's physical activity, and we're very concerned about that. We did a poll survey among adolescents and young people, and we noted that a lot of them had, in fact, reduce the physical activity, and women or girls even more than men. So it is really something that even sort of, in the here and now, when we're talking about, quarantine measures or prevention measures for COVID-19, that we need to find a way to keep some physical activity possible, be it in the home or be it, having specific guidelines for that, because the pandemic is more than a year old, and children are growing up in that without the opportunity to play and to run around sometimes and have these things. So it's very important that we start the healthy habits from early on, that we support parents to do that, both for the physical and mental health of families overall.
Thanks. Natalie, could you reflect on your special lens on this issue of connecting food and exercise?
Yeah, sure. Well, we see that those two things are key for a healthy food environment. And I think, well, now, for example, we work with the Chief Resilience Officer of the city of Quito, in the implementation of the resilience strategy. No? And one of the key pillars is active life. And of course, pedestrians, cycling, etc. But this has to be linked, of course, and when we link it to the other pole of healthy food environments, we notice that it's important to have this in mind in the very beginning, no? Because we also observe that schools are usually surrounded by places that do not necessarily offer healthy food. Of course, now with the pandemic, for example, in the case of Quito and in most of the cities in Ecuador, schools haven't reopened yet. So we have to also, you know, in maybe preparing to go to school, look at this also, no? The other thing is that we noticed that, you know, Latin America has very high rates of informality. So we have noticed that many informal vendors, food street vendors, before the pandemic, they used to go to the school to sell all types of food, and this is not regulated. This happens in all types of cities, you know, intermediate cities, but also big cities. And this is something that can be tackled also by different authorities, and also probably it has to do with design as well. And we have to, of course, think of a sound sustainable mobility policy, because we cannot really encourage active mobility unless the public space is safe for children to, for example, go on bicycles, and mothers to take them to schools, etc. And also that's why I really make an emphasis on designing the city also from a female perspective, because females also take into account care and motherhood, and in our continent especially elderly care, because we are the ones that have to take care of it. Of course, I hope it changes at some point, but for the moment it is as such.
Yeah. And I think, Dr. Curiel, you talked a little bit about how you connect the dots in the government level, which is really, really important. Let me ask another question to all of you. One of the emphases, obviously, of UNICEF and the Healthy Cities for Children and Adolescents and Child Rights is engaging young people in, you know, in sort of informing decisions, if you will, about program design and policy, but also in many cities actually actively engaging, deciding on structures that actually allow young people to come into and speak directly to government officials, or having youth councils, or having other kinds of activities that not only invite young people in, but also create a mechanism where they can have ongoing input and ongoing dialogue. I wanted to have maybe each of you talk a little bit about how in your initiatives, obviously government working with farm workers and food movement, and UNICEF, the sort of engagement of young people directly, most directly in program design, in policy work. Let me start with Dr. Curiel again, maybe if I may.
Claro que sí.
Of course.
Particularmente es un tema
It
que
is
me
a topic
apasiona, ¿no?
that
Yo
it's
creo
my
que
passion, actually.
cuando América
Latin
Latina
America
ha venido
has been
cambiando,
changing,
el poder de los
and
jóvenes
young
y de nuestros
people and our adolescents,
cada vez se muestra más, ¿no?
you can see
Yo
their
creo que uno de los
power
grandes
now. I think
retos
one
y
of the big
desafíos que
challenges that
tenemos
we
es
have,
poder que
it's
nuestros
for our
adolescentes y nuestros
adolescents and our
jóvenes
young
tengan una
people to have
participación
this
política
political
y crear esos
participation, and to
espacios en
create these
donde
spaces
puedan
where they can
converger y poner temas en la
put
agenda, ¿no?
their
Yo creo
topics
que
into the
también
agenda.
lo
I
puedes
think
hacer
you
de
can do it
diferentes maneras,
in
¿no? O
different
sea, en el
ways.
gobierno
In the
hay
government,
diferentes
we have
comités
different
en
committees
lo que los
where
podemos
where
escuchar
we
la
can
voz de los
hear
niños, en
the
los que podemos
voices of
escuchar la voz de
children,
los
the
adolescentes
voice of
y de una u otra
adolescents,
manera intervienen
and they
en prácticas
intervene in specific
específicas, ¿no?
practices.
Yo creo
I
que hay
think
algo
there is
importante y es
something
que
important, and that
los
is the
adolescentes y los
adolescents and
jóvenes
young
se
people.
empoderen
They
de la
have to
agenda pública, o
empower
sea,
with the
que ellos
public
puedan
agenda, that they
hablar y
could
decir
speak
lo
up
que quieren,
and
pero
say what they
también que
want, but
nosotros como el
also we
gobierno
as
podamos
government
dar las
can give
herramientas
them the
necesarias
necessary
para que ellos
tools
puedan
for
construir y
them to
aportar planes de
build
acción, ¿no?
their
Entonces,
action plans.
creo que
So I
la
think
participación
the
política
political
de cada uno
participation
de estos
of these
adolescentes
adolescents
y más
and
que todo en
and,
llevarles
and to
la
bring
voz y
their
que puedan ser
voice
escuchados
so they could
cada
be
día
heard.
nos está
I think it's
ayudando a que
helping
sean
us
ellos los que tomen las
so them
riendas. Siento
take
que
care
se
of it.
cuestionan ahora
I think
completamente
they
diferente
have
y me
different
gusta
questions
una
right now, and I
frase
like this
que siempre
quote that I
menciono en
always
el Comité de
mention in the
Adolescencia
adolescents
y es,
committee, and that is that
nosotros no
we are
hablamos
not talking
de los y las
about the
adolescentes, hablamos de
adolescents.
las
We talk
adolescencias, o
about
sea,
the
tú te
adolescents.
recreas tu
It's like you
cotidianidad
recreate
y
your
desde lo que
daily
tú
habits,
vives
and from
puedes
what is your daily
levantar la
living, you
voz.
can speak up
Creo que es el
from your
momento
daily
de hacer
habits. So I think it's
hincapié en la
important to
importancia de
highlight
que ellos
how
puedan tomar sus
important it
propias
is for the
decisiones,
adolescents to make
pero
their own
nosotros
decisions, but
guiarles,
we
¿no?
have to guide
Creo
them.
que
I
tienen más que
think they
enseñarnos
have to teach us
ellos
a
a
lot,
nosotros y
and
estaremos
we are
allí para
going to be there
apoyarles
to
a que la
support them,
participación
so
y puedan poner
for their
temas en la agenda pública.
participation, and so they can be part of the public agenda.
It's a really important message. I think we'd hope many other government officials would be as open to that, which could make enormous change. Natalie, let me ask you to talk a little bit about involving young people in your work directly.
Yeah, sure. Well, from the NGO perspective, we work towards providing the evidence for policymakers. And so we encourage, for example, in all our initiatives to integrate the work with youth, both in rural and urban areas, because as much as we, and I think the key point about cities, but we really see a difference between small, intermediate, and large cities. So several studies have been released in terms of that cities are not really sustainable on their own, especially mega cities. And so that's when we have to start to look back to the countryside, to the field, to the rural areas, and see what is it that enables young people to live in a decent way in their own territory before they have to migrate the cities and we continue to enlarge the cities. When we look at small and intermediate cities, we see that there is a huge potential to stop, massive sprawl, urban sprawl, and integrate the work with youth, both in those two areas. So we encourage, on the one hand, we work with farmers' organizations so that we, for example, experiment on regenerative agriculture and find ways to generate extra income from adding value to the different food produced. So now that superfoods are a top trend, we see, okay, so how can we explore with youth, with youngsters, alternatives so that they can create value, and not necessarily in farming, but they can also be involved in many other tasks around farming, so communications, marketing, even processing, etc. On the other hand, when we talk about youngsters in cities, we are connecting with them to encourage or to look well into their entrepreneurial ideas. So we work together, for example, with the municipality of Quito that hosts an incubator for youngsters so that modules and capacity building is adapted to them. And we also look for the youngsters in the rural parishes or in the rural areas that belong to the municipality, because this urban-rural continuum is something important to keep in mind in our continent. Of course, Latin America is the most urbanized continent in the world, but that is exactly why we have to care after the provision of ecosystemic services. So we have to make sure that the territorial planning, both the city planning, but also the government planning, takes care about the ecosystem services that are provided to the city that are sustained by the rural areas.
Thanks very much. Really important from a different, looking at multi-sectoral engagement of young people. Micah, this is UNICEF's business, really. So can you talk to us a little bit about the approaches in this nutrition sector?
Yes, thanks a lot. Yes, it's really part and parcel of our work, but also specifically in the context of the Child-Friendly Cities initiative, where we often sort of certify municipalities or cities, with certain criteria, and child participation is one of those criteria. And for example, and then there are different ways, of course, in which children can be involved in general. I mean, sometimes we do a poll more broadly, like we have something that we call U-Report, where we ask large groups of young people and adolescents for their views, or we document lived experiences and we publish those views. But then also very specifically in the context of the Child-Friendly Cities, we do want and encourage and support active participation of children. And it can be like Dr. Curiel was mentioning, actively consulting with children on that. And for example, in Brazil, we work with municipalities that have systems for that. In Colombia, it's with the territories actually that we work more, but still also with child participation in decision-making bodies. In Costa Rica, it's the cantons. In Paraguay, it's municipalities again. But so actively listening to children in the first place and then bringing them into decision-making bodies. That's crucial. Thanks.
Great, thank you. So let me ask you, we said we were going to end about 10 minutes early to let everybody take a break between now. Dr. Curiel, you have another comment?
Yes, of course. I just wanted to comment something on the experience that we had here in Colombia. When, I'm going to put it this way, when we were in a lockdown, the priorities for young people changed. They became different. And I think many were able to listen to all these social mobilizations that we had in Colombia that were led by adolescents and young people, very similar to young movements that we have seen in the Latin American dynamics. At the beginning of the pandemic, we had this moment where we gave orders and everyone had to be in a lockdown because we have to take care of ourselves. But I think young people have started showing us that their priorities have started to change. They started to change by considering many of the topics that we are covering here today. And Bogota changed and the priority changed to a plan of social rescue for young people, for women and families in poverty. So it's a plan that had started in the framework of economic reactivation, that is for our young people to have access to education, a basic income, but also to give priorities to children in Bogota and to be able to reach 100,000 beneficiaries. Young people said, we want to study, we want free education. And I think when you want to actively participate in politics, you need to have education to be able to speak up. If you're qualified for it, it's completely different if you are just if you only have empiric knowledge. So I think the basic needs have changed, and that has shown us the agenda that we have to have with young people and adolescents. I just wanted to wrap up with that. Thank you.
I think that's a really important point, and I was going to ask each of you to give us your sort of one takeaway, and I think you articulated that very well. It's time to listen to those voices because things are changing for all of us, I think, as a result of COVID, but it's a very important message to listen to adolescents, to listen to children, and engage with them actively. So thank you for that. Natalie, just one takeaway from your experience?
Gracias.
Thank you, Joe.
Excelente panel.
It was a great panel. All women here, so it's a pleasure. It was a pleasure. I want to congratulate UNICEF for their commitment. It was great to be with Neki, Iliana. I want to support the Colombian people. I think what she mentioned in a Latin American region, it's very important to look at equality, because more inequality brings more violence. influence. So when we talk about urban planning, it's what we see. The poorest neighborhoods is where we have more food inequality, and that's why it is important for our public policies. We have agencies, the universities, the NGOs to be able to provide support to create these action plans. And I hope that our children all can have better eating habits. So thank you, everyone.
Thank you very much. I think, as was emphasized in our opening plenary, equity and the disparities in the region are very, very dramatic and are fundamental to achieving the things that we've been talking about. Maike, your last takeaway for you from the panel and discussion?
Yes, thanks a lot. I think it was really great how we all complemented one another, and I think there was a really great setup, and I learned a lot actually from all of you, so thanks a lot for that. And I think it shows the importance of partnerships. I think, you know, between government, UN organizations, civil societies, and private sector, as long as we can avoid conflicts of interest, obviously, I think it's really great. We complement each other, and we need to work together, you know, cross-sectorally and with all levels of government and with all stakeholders in society. So thanks a lot for that.
Very good messages. Let me thank the panel very much for a super rich discussion and answering our questions in a really, really deep way. Great representation from multiple sectors, and to UNICEF, to Novo Nordisk, to EAT for allowing us to have this as such an important panel here at the International Conference on Urban Health. So with that, I'll bring us to a close, and everyone take a break and get ready for our next plenary starting at 10 a.m. Eastern Daylight Time, about 10 minutes. So thank you so much. Bye-bye.
Thanks a lot. Bye.
Gracias. Adiós. Bye.